Reduction of Patient Falls in Healthcare Facilities by Tracy Booker.
Tom Foraker.
And Becca Waldeck.
QSEN, domain, safety, to minimize risk or harm to patients and providers through both system effectiveness and individual performance. Patient falls, a big issue. In an average 800-bed acute hospital, there will be around 24 falls every week and over 1,260 falls every year. The NPSA estimates that there are over 530 patients every year who fracture a hip following a fall in the hospital and a further 440 patients who sustain other fractures. Why should nurses be concerned? Increased falls in healthcare facilities is due largely to poor assessment. Think about it logically. It makes sense. Without the nurse completing an accurate and correct assessment, who will? It all starts with the nurse and the assessment. Imagine a house being built without the foundation. Issues and current standard assessment. Intrinsic and extrinsic factors account for falls risk. Intrinsic, vision disturbances, dizziness, incontinence, muscle weakness, mental impairment, gait and balance disorder, and polypharmacy. Extrinsic factors include slippery floor, equipment in the way, object on the floor, inadequate lighting, and poor footwear.
Utilizing the holistic approach. Assess patients thoroughly and connect the dots with the patient history. Essentially, every body system dysfunction can increase a patient's risk for falls. Think about it critically. Remember, extrinsic and intrinsic factors both affect a patient's falls risk. How can nurses prevent falls? Make sure you have an effective plan of action. Also, nursing assessment skills need to improve. Available and feasible assessment tools need to be at the nurse's disposal as well. Remembering the holistic model of care, implementation of environmental assessments are necessary. Effective assessments. Elimination of subjective judging needs to be eliminated. Simplifying grading upon assessment will be beneficial. They'll help by the patient is at risk or not at risk, creates a more time-efficient approach, yet states if the patient is at risk or not at risk. Continual assessment of patients is vital as level of consciousness, cognitive status, and physical status can change rapidly. Example of assessment. Seibert explains in the 2010 edition of Nurse magazine that different questions that can be used on the assessment. Questions include, when was the last time you fell, including the past week, month, 3 months, 6 months, past year, or not applicable. Second question, when you fell, were you injured? Third, if you answered yes to number 2, explain your injury. 4, have you experienced bowel or bladder urgency or frequency within the past 6 months? 6, do you require assistance with walking? If yes, ask them, what do you use? Another person, walker, motorized device, railing, crutches, wheelchair, or other, also examples of assistant devices.
Environmental assessment. Medical equipment, patient's belongings, saturated floors, IV tubing, etc. are all extrinsic factors. Many hazards may be present and nurses need to act accordingly to decrease the risk of falls. It's important for nurses to be continually aware of environmental changes, such as families and friends coming and leaving, physical and occupational therapists, nutritionists, social workers, and other staff continually entering and exiting. How can we improve our assessments? Through education and training of staff members, separate classes need to be instituted, particularly nurses working on geriatric units. Communication, and communication. Collaborative effort, reporting off, nurses must communicate to the nurse if any change in neurological or physical status is present. STNAs, physicians, therapists, other nurses need to be reminded about patients' fall risk status. Potential barriers to change. Knowledge. Certain nurses may be unaccepting towards a change. Attitudes. Certain personnel, including nurses, may dislike the new assessment techniques and having to complete a separate assessment from the standard head-to-toe assessment. Habits. It's difficult for new assessments to be implemented as seasoned nurses are comfortable and skilled at completing present fall risk assessment protocols. Knowledge. A knowledge deficit might be that the nurse is unaware of the research. She also may not be able to understand the statistical analyses that are presented by research. She may feel isolated from colleagues who are knowledgeable about the research. She may also lack the skill set necessary to support use of research for evidence-based practice. Attitude and habits. A nurse may be unwilling to change or try new ideas. She may like and expect the norms of her institution. Communication can work as a facilitator to change, but it can also act as a barrier to collaboration. Ability to work together toward a common goal. Capacity of team members to understand their own role and of responsibilities of other team members.
Measurable outcomes. Improved collaboration and communication between staff. Asking nursing staff and other healthcare providers if they believe communication about patient status has improved. A decrease in the number of falls per year once the improved assessment interventions are implemented, as well as documenting current research findings and compare results after 1 year once the implementation of interventions are in place. Monitoring outcomes. Interview all floor nursing staff at every 1 month, 3 month, 6 month, and 12-month intervals. Assess research findings and compare fall rates before intervention and 12 months after the intervention has been implemented. Also, give families and patients a simple 1-question survey, questions 1 to 5, scale 1 to 5, stating how safe they feel in the hospital.
Communication with staff members. Continually ask staff about thoughts of the changes implemented. Request from management a 5-minute staff meeting each shift once a week to gather feedback from staff regarding any questions and suggestions from nurses about the interventions. Keep staff motivated. Keep the staff's thought in perspective. The primary goal is patient safety. Improving assessments will help decrease falls, improve patient outcomes, improving hospital budget, as well as decreasing the time-consuming incident reports.
The team. Implementation of the plan will be a collaborative effort including nurse managers, nursing staff, including PCAs and RNs, environmental services, for example, physical and occupational therapists and janitors, volunteers, family, and friends.